What can you expect to feel when you get spinal anesthesia for a C-section? Does it hurt? I'm an obstetric anesthesiologist who's had a C-section myself, so I'll tell you. For most women, the pain of the procedure is not much worse than getting an IV, although it can be more anxiety producing. The spinal is done with you in a sitting position, or less commonly, it can also be done with you laying on your side. Either way, you are going to be curling over your baby and pushing out your back to widen the spaces between your backbones. First, your skin is cleaned with a sterile skin prep that can feel cold and wet. Then a sterile drape is put on your back to cover everything except the area where the spinal will be placed. Most of the time, spinals are done by looking at your back and feeling your spine and hips to determine the best place to put the needle. Once we have felt your back and decided where to place the spinal, we use a tiny needle to inject some local anesthetic in the skin, at the spot where we are going to put the spinal needle. This definitely stings, kind of like a bee sting, but it only lasts a few seconds. After the skin is numb, we put in a short introducer needle, which is about as thick as an IV. That might feel like an uncomfortable pressure in the center of your back, but many people hardly feel it. If we need to adjust the direction of this needle, this is when you might get more uncomfortable or the procedure might take a little longer. Then we put the spinal needle through the introducer needle. The spinal needle is super thin, but a little longer so that we can reach the spinal space. Once we see spinal fluid coming out of the spinal needle, we know we're in the right spot, and we inject medication into the fluid. Then we remove the needle.